So, good evening, everyone. One short series, blood stain and seminal stain. As you know, blood stain, the seminal stain, is a part of corpus delicti. Am I audible and visible? Yes, good evening. Radiology, Real, Manak Datta, Rakesh, Kid. Am I audible and visible? Can I just confirm in chat box? See, corpus delicti means essence of crime. Like example, murder. The essence of crime is the dead body, the blood stain, the weapon that is used, the injuries on the body, and other circumstantial evidence. The blood stain is very important in solving case. The blood stain can be fresh blood, or it can be old washed blood stain. Blood stain is also useful to identify the person by using DNA fingerprint, by using nucleated cell, not the RBC. Yes. What are the tests for blood stain? The blood stain can be identified with the help of two types of tests. One is screening test. The second one is confirmatory test. The screening test, they are highly sensitive. They have more true positive value. So screening test basically depend upon the principle that the hemoglobin has peroxidase activity. So try to understand, RBC is equal to plasma plus hemoglobin. The hemoglobin has peroxidase activity. This peroxidase, which acts on the hydrogen peroxide, that is H2O2, it converts into water and oxygen free radical. So this property is used in identification of blood stain by using many reagents. Yes. Manak Datta, that's okay. Yeah. Benjidine test. Benjidine is one of the tests for blood stain. We use Benjidine reagent. As I said, when Benjidine reagent is mixed with the suspected blood stain, because of the peroxidase activity, there is a formation of blue color. So what is the color? Blue color. But this Benjidine is carcinogenic. It is not used nowadays because it causes bladder carcinoma. Okay. Second, phenolphthalein test. Phenolphthalein test is the most common test for blood stain. Most common. It is also known as Kastle-Meyer test. Again, the color is the pink color. P for phenolphthalein, P for pink. So all of you write in the chat box. KM test is equal to pink color. Write this in chat box. Rakesh, Manak Datta, everyone. So, forget. Then the third test, tetramethyl benjidine test. Again, the color is blue color. Luminol test, very important test, luminol test. It is used in old washed blood stain. So the question can be asked, old stain, washed blood stain, what is the test that is used? Your answer must be luminol test. We use luminol reagent, and this is done in a dark room. If blood stain is there, that gives bluish glow. Yes, so good answer. Rakesh and others, that's great. Leukomalachite green test, the color will be green. Orthotolidine test, the color is blue color. So all these are screening tests. And remember, they are not confirmatory tests. The confirmation is very important in court of law. The court asks the evidence. What are the confirmatory tests? Can anyone tell me? What are the confirmatory tests for blood stain? So there are three tests. One is Takayama test, Teichmann test, spectroscopic examination. Confirmatory test है Takayama test, Teichmann test, and spectroscopic examination. The funda is, so hemoglobin, it forms hemine crystals. Are hemochromogen crystals. When hemine crystals are there, hemochromogen crystals are there, then it is confirmatory of blood stain. What is the color of Takayama test? The color of crystals in Takayama test is pink feathery crystals. Pink feathery. How to remember? Takayama is there, no? Takayama. You can remember Takamama. Mama is pink. Pink mama with the feather. So pink feathery crystals, they're classical of Takayama test. How you can remember? Just type in the chat box. Pink Yama. Or you can remember Mama. You know, Mama is favorite of everyone. Mama hai na? So pink Mama with feathery crystals. So very commonly asked in INICET. So some fun is needed to remember certain facts in forensic medicine. Yama, Mama, pink Mama, feather. Okay, good. Chal, good ho gaya. Then Teichmann test. In Teichmann, the color of the crystals are basically brown, rhombic crystals. The best test is spectroscopic examination. So this is in brief about blood stain. Now let's see that test. Okay? Look at this. This is a crime scene of murder. 103 BNS. Murder. And what you can see here, the color. The color is pink color. Can anyone identify what is the test that is used in this crime scene? Yes, come on. Managata and others. What is the test? So what you can see here, pink color. So it is KM test or Phenolphthalein test. Good. Good answer. Second test. Look at this. This is a case of rape and murder. A rape and murder. And the bloodstains are washed. The total bedroom, it was washed by the accused. And you can see here, there is a reagent. Reagent is applied and the stains are observed in a dark room. When they're observed, what you can see here, bluish glow is there. So what is the test? So this is basically luminol test. Luminol, old wash blister. Now look at this two tests. Again, confirmatory test. A and B. So in A, pink feathery crystals. In B, brown rhombic crystals. So what is the answer? Try. Yes, A and B. A is Teichmann test. B is Takayama test. You can make out now. Now you can make out very clearly. Okay. Now look at this test. See, this is a Teichmann test. The suspected bloodstain is taken, which is heated. So once you heat, there will be evaporation of the plasma. You can see there are RBCs. So RBCs are collected at the center. You need to add glacial acetic acid along with the sodium chloride. So the reagent used in Teichmann test is glacial acetic acid and NaCl. So once it is added, you need to heat. So you need to heat from the below. The heat and dry. Then you observe under the microscope. So there are brown rhombic crystals are there, which are crystals of hydrochlorate of hematine. So there are hematine crystals. That means it is a blood stain. It is a confirmatory test that is used in case of forensic science. Hope you are getting my point in the video. Okay. So the next is seminal stain. See, seminal stains are very important in case of rape and murder or in case of rape. If semen is there, that means there is an intercourse. Spermatozoa is there, that means there is an intercourse. That is spino-vaginal intercourse. Or if it is there in the anal cavity or oral cavity, that is also shows that there is an intercourse. As I said, rape is a offense, heinous crime. Penetration, insertion, manipulation and application is a crime. We discussed as per 63 BNS in last class. Seminal stain is very important in rape and murder cases. Sometime in case of divorce, in case of adultery, in case of disputed paternity. Even DNA fingerprint also can be done by using epithelial cells. What are the tests? There are many tests. So one confirmatory test is presence of spermatozoa in the gram stain or Christmas staining. What are the screening tests? Acid phosphatase. Mnemonic is ABCDEFG. So write this mnemonic in chat box. Seminal stain is equal to write ABCDEFG. Okay. A for not apple. A for acid phosphatase test. Acid phosphatase is an enzyme that is commonly present in seminal stain. So that is used in identification. Ammonium molybdenate test, which detects phosphorus in the seminal secretion. Barbario test, one of the very important screening tests. So Barbario, the color of Barbario test is yellow needle-shaped crystals. So when you see so yellow needle-shaped crystals basically form a Spermine picrate. Okay? The spermine is present in seminal vesicle. That combines with the picric acid, it forms spermine picrate that give rise to yellow needle-shaped crystals. Barbario test, commonly asked. Then creatinine phosphokinase test, Christmas tree staining, C for D for dehydrogenase, that is lactate dehydrogenase, one of the most specific enzyme, or by using UV rays. ELISA test, Florence test. So Florence basically the formation of brown rhombic crystals. So they are made up of choline iodide. So the choline present in the prostatic secretion that combines with the potassium iodide, it forms choline iodide that forms brown rhombic crystals. When brown rhombic crystals are there, then it is basically seminal stain. Yellow needle shaped crystals are there, then it is Barbario test. याद रखना पड़ेगा, ठीक है? Then glycoprotein P30 test, commonly asked. ठीक है? All is our test. Now look at this image and try to answer A and B. So in A, yellow needle-shaped crystals are there. In B, dark brown rhombic crystals are there. Can I identify the test? Come on, guys. So this is basically Barbario test. This is Florence test. Good, Menak Datta. Very good. So Menak Datta, excellent answer. Cha. So now the last 10-15 minutes. So we will start forensic filmy funda. Are you there, guys? 10 questions are there today. So you need to answer. So today we discussed some important screening tests in blood stain and important test in seminal stain briefly. Both are 3 marks question. So this is more than sufficient. Now let's see some 10 MCQ. And as you know, this is the last class of one short series. Forensic filmy funda, 3F series. You need to go through the video, maybe some movie clips or some real life examples. You need to identify what is the cause of death or some related facts. Yes, are you there, guys? Filmy funda? Say yes or no? Yes, the first question. So what is this? So this is a case of electrocution. It is a high voltage burn. So when I talk about high voltage burn with the loose contact, there is a formation of flame burns or flames. So which causes brown rhombish nodules. Okay? So during autopsy, brown nodules. So this is known as crocodile skin burn. So the answer is crocodile skin burn is the correct answer. So most of the time the cause of death is vasovagal inhibition or sometimes respiratory paralysis. In this case, probably ventricular fibrillation, or it is respiratory paralysis. So let's remember, cause of death is ventricular fibrillation or respiratory paralysis. Endogenous burn is also known as jewel burn, nothing but entry wound. Filigree burn, that is seen in case of lightning. So the answer is A is the correct answer. Good. And the second question. So here is the snake and there is a mongoose. In the snake, what you can see here, spectacle mark. Spectacle mark is there, a round pupil, large head scale, and which is neurotoxic. So what is this snake known as? So this snake is basically common cobra. Common cobra. You can watch once again. The common cobra is neurotoxic. The fatal dosage 15 milligram. What are the clinical feature? Ptosis, respiratory paralysis. So ptosis, there can be some local signs like local pain, broken neck sign, paralysis of the muscle, especially respiratory paralysis, and death. So the fatal dosage is, I said, 15 milligram. Fatal period is around 6 to 12 hours. Treatment is anti-snake venom. The scientific name of common cobra is Nasa. Nasa. Okay. And again, question can be asked, what are big four snakes? What are big four snakes? Yes, guys. In forensic, they can ask you in Viva, which snake are, what are big four snakes? There are 2 neurotoxic and 2 vipers. Big four, we have one is common cobra, common krait, Russell's viper, saw-scaled viper. So this is entrance question, very commonly asked. Good, many answer. That's great. Chalo, ho gaya. And these vipers are hemotoxic. So increases clotting time and bleeding time. The test done is 20 minutes whole blood clotting test. Okay, good. Now look at this and try to answer. A basketball player died due to fall of a pole. Cause of death is head injury, cardiac tamponade, cervical spine injury, and all the above. Look at this video. So now you can see here there is a fall of a pole. directly into his chest. So there can be head injury, cardiac tamponade, or cervical spine injury also. That we will confirm during postmortem examination. So time being, so the correct answer is all the above. Now, the next question, the fourth question, this curiosity, the curiosity of so in this case, the case of child came with a history of asphyxia, that is difficulty in breathing. The child head is entrapped in a steel vessel, so while playing. So what it causes? So when head is entrapped in a closed space, what it causes? Suffocation, asphyxia, vasovagal inhibition, cranial trauma. So this is classical case of suffocation. So suffocation leads to asphyxia, leads to death of the person. Asphyxia. So just remember, asphyxial death is classified into hanging, strangulation, suffocation, and drowning. So in most of the cases, the cause of death is hypercapnia and hypoxia. Okay? Yes, suffocation, correct answer. Now, burn injuries in adults are calculated with the help of. So here is a case of accidental burn in an adult. Burn injuries in adults calculated with the help of. Options are Nisten rule. Nisten rule basically for rigor mortis. Rule of 12, that is basically rigor mortis. Do you know rule of 6 in forensic? Rule of 9 is the correct answer. That is also known as, that is one of the common formula that is used in case of estimation of burn injury. In case of scattered burn, we use Palmer rule. In case of children, we use Browder formula. Okay? So burn injury. In adults, we use rule of 9 or rule of Wallace. In children, Browder formula. In scattered burn, Palmer rule. Okay? So in burn injury, the cause of death is Either it can be hypovolemic shock or carbon monoxide poison, or late death. The cause of death is sepsis. This is commonly asked in exam. Okay, good. Rakesh, good answer. All are answering, that's great. Now look at this, very interesting.
एक सेकंड, लेकिन ये साला कर क्या रहा है?
Doctor involved in a sexual affair with a patient can be charged with which of the following as per NMC regulation? Infamous conduct, covering, dichotomy and association. So try to remember infamous conduct. Is the answer. The infamous conduct is dishonorable, disgraceful conduct of a doctor. The mnemonic is 6A. A for abortion. When doctor is involved in some illegal abortion or abortion without any proper indication as per MTP Act, infamous conduct. When doctor is association, A for association. When doctor is involved in some unqualified person, that is known as association, is also known as covering. Or doctor involved in adultery, that is sexual affair with the patient. When doctor is addicted to ganja, heroin while treating the patient, or treating the patient under the influence of alcohol. Okay? Then A for advertisement. Using large signboard. Okay? So for advertisement, for a doctor, it has specific rules as per NMC. Using large signboard or repeated advertisement about the treatment, before treatment, after treatment, giving 1+1 offer, doing advertisement for certain diseases in which the doctor is not qualified. All these are basically advertisement, so comes under infamous conduct. So can anyone tell me, Rakesh Menak Datta, what is the punishment in case of infamous conduct? What is the punishment? See, punishment is either warning or suspension or professional death sentence. That is removal of name of the doctor from the medical register. So remember, warning is given by State Medical Council. Okay? In case of warning or in case of suspension, in case of PDS, so doctor can approach NMC, especially EMRB, Ethics and Medical Registration Board, appeal. The appeal usually to the EMRB, that is the separate body of the NMC. NMC, there are 4 different bodies like UGMEB, PGMEB, EMRB and others. Okay. So warning or suspension. Kaushik, good answer. Fine. What do you mean by dichotomy, guys? डाइकोटमी क्या होती है बताओ? डाइकोटमी मतलब फी स्प्लिटिंग, गिविंग कमीशन, टेकिंग कमीशन in relation with patient treatment, patient referral or patient discharge. cuts business is known as dichotomy. Like example, a doctor is taking 1000 rupees fee and he is going to give 200 rupees to the middleman. Our doctor is referring someone to some other doctor. For that he will get cuts. So cut practice, commission, giving commission, taking commission is dichotomy. इसको बोलते हैं हम fee splitting. ठीक है? Yes. Fee split. Good, Sajid Kumar. That's great. So this is important concept. Now look at this question. This is a very nice question again. So here there are two snakes. So one is common cobra, which is neurotoxic. The fatal dosage of venom is 15 milligram. It produces bungarotoxin. The clinical features are ptosis, paralysis of the muscle, respiratory paralysis, nausea, vomiting, broken neck sign and death. The second one is Russell's viper. In Russell viper, you will see brown spots. And also you will see triangular head, constricted neck, broad body and pointed tail. The fatal dosage is somewhat 20 to 30 milligram of dried venom. So this is basically hemotoxic. So the treatment is ASV. The ASV is the treatment of choice. The most common side effect is anaphylaxis. The same dose is given in children as well as in case of adults. So ASV can be a 3-mark question. Okay, good. Kaushik, that's great. Many answered. That's fine. Then look at this video and try to answer. This is a case of maggots. In a murder case, during autopsy, maggots are collected from the body, should be preserved in which of the following? Which of the following? So options are ethyl alcohol, sodium chloride, formalin, sodium fluoride. See, in case of maggots, the maggots are collected. Some live maggots are collected along with the piece of quadriceps femoris muscle or deltoid muscle. Live maggots in one bottle. Okay, in 2 bottles. So example, this is the bottle number 1. So this is the bottle number 2. Live maggots. Maggots means they are larvae of the adult fly, Musca domestica. So in muscle, especially the muscles of the thigh. So to find out the species. Okay. And some dead maggots are preserved in ethyl alcohol. So the answer is ethyl alcohol, correct answer. It is not sodium chloride, not formalin, not sodium fluoride. You can see here the same video once again. So it is collected in not water, in ethyl alcohol. One of the very important evidence in estimation of age, estimation of time since death, or sometime the place of crime, or the poison used in the murder case. Okay, so answer is हो गया. Then now look at this video one more. Injury to the hand while sitting next to the window seat most commonly causes which of the following type of laceration? Cut laceration, avulsion laceration, split laceration, stretch laceration. So again, this is an educational video just to tell you that, while traveling by bus, don't keep your hand outside the window. Sometime there can be serious injury like avulse laceration. So the answer here is avulse laceration. So the laceration can be of 4 types. Stretch laceration, avulse laceration, then we say split laceration, then cut laceration, and all. So the avulse laceration is characterized by flaying or sometime amputation as well. Amputation or degluing injury. So the best answer here, avulse laceration. Okay. Some books give tear laceration also. Sojit Kumar is telling, sir, which movie scene? I'll let you know. Even I forgot. It's a Malayalam movie. So good. Rakesh, cut laceration. C. B is the answer. That's great. Split laceration is commonly seen over the bony prominences. The cut laceration, nothing but it is an incised wound. The tear laceration usually caused by blunt object with some sharp spines, like example broken beer bottle, like that. So answer is simple, avulse laceration. Kaushik Kumar, yes beta, I am Gurot. You are doing neat, good, great. So we will see you in 3rd year MBBS forensic medicine. Okay, all the best. And Kaushik, good answer Kaushik. Kaushik, great. Next question, the very interesting question. Look at this.
काटो काटो जल्दी काटो भाई जल्दी काटो अरे भाई रुक जाओ कुछ नहीं होगा यार कुछ काटा तो नहीं अभी काटा तो नहीं है रुक जाओ आराम से अरे भाई अरे बहुत खतरनाक है यार रुक जाओ भैया बचा लो आराम से भैया बचा लो जल्दी काटो जल्दी काटो संभाल के काटना देखें अरे भाई बहुत जल्दी काटो अरे भाई रुक जाओ
What is this snake? Now you can see, when you see hood, spectacle mark, okay, hood is there, spectacle mark is there. So this must be common cobra. Common cobra is the correct answer. Okay? Yeah. So this completes your 10 questions. So I hope you understood all the question and answers. Yes, guys, any doubt? What is your score out of 10 questions? Score batao. Swajit. Menak Datta. Rakesh. Good. Rakesh got 8. Menak. Yes, Kaushik. Swajit also. Kaushik. So Menak got 10. Swajit Kumar got 9. So this completes our today's session. So any doubt in forensic medicine, you can ask me for next 5 minutes. Swajit, Menak, Kaushik, Rakesh, and other students. And I have one more question for you. Now let's discuss one more question. The question is, how to identify species in skeletal remains? Yes. Now, say example, this is the bone, it's a real bone, real skull that is found in the crime scene. My question is, how to identify the species of the skull, whether it is human or animal species. How to do that? Can anyone tell me? Swajit and Kaushik. Species. How to estimate the species? By a test known as precipitin test. So it is basically an antigen antibody reaction. So the antigen, a suspected antigen, is mixed with the human antiserum. If there is a precipitation reaction, then it is positive for the human species. Okay? Yes, precipitin test. Yeah, it can be Swajit Kumar, it can be indecent assault, that is 74 BNS, and also 64 BNS, rape also, disrobing also, sexual harassment, many things, many sections are there, BNS. Okay, good. By precipitin test. Now, one more question for you. The one more question is, how to identify race of the person? Race. See, the race can be dolichocephaly, mesenterocephaly, or it can be brachycephaly. My question is very simple. How to identify race of the person or the skull? By using spreading calipers. Okay? What is that index? Menak Datta and others, try. So by using the maximum length, that is between the glabella and occipital protuberance, and the distance between the two parietal eminences. So maximum breadth divided by maximum length multiplied by 100. If the value is between 70-75, then it is dolichocephaly. 76 to 80, then it is mesenterocephaly. More than 80, brachycephaly. The typical Indian skull comes under mesenterocephaly. Mongolians comes under brachycephaly. Pure Aryans, African Americans comes under basically dolichocephaly. So 2 questions, guys. So species identification, that is the precipitin test. Race identification, that is with the help of cephalic index by using spreading calipers. So all of you write in the chat box cephalic index, right? Cephalic index in the YouTube chat box. Keep writing. Kaushik, Sajit Kumar. Good. Dr. Demon, good answer. Now age estimation. How to estimate the age? Now look at this skull. Now you can make out a sagittal suture. This is the sagittal suture. The sagittal suture is not fused. It is completely open. It is completely open from the inside as well as from the outside. Look at the sagittal suture. The sagittal suture is not obliterated. You can see the clear gap between right and left. And also you can see the light which is passing from inside to outside. That means sagittal suture is not obliterated. My question is, what is the age of this skull? बताओ जल्दी, age क्या हो सकता है? Yes, Dr. Damon is telling, sir, sagittal suture is best. Yes, you are right. Sagittal suture is best. So, sagittal suture, when it is unfused, the answer is, it is usually 30 to 40 years. Usually middle age, 30 to 40 is the correct answer. When it is totally obliterated, probably it is more than 60 years. There are many sutures, lambda suture, parietal suture, sagittal suture, coronal suture, metopic suture and all. The best suture is sagittal suture. So, first thing we discussed about the race. Second, we discussed about the species. Third is the age. Then the sex. Now look at the skull. Now the police will ask you, say example, this is the case of murder. The skeleton was found in the crime scene. The police will ask you, sir, male or female? क्या है, पुरुष है और महिला है? Gender बताओ. Now my question here, this skull which is having steeper forehead, rectangular orbit, glabella is prominent, muscle markings are prominent, bony markings are prominent, mastoid process is prominent, foramen magnum is large, frontal parietal eminence is small, male or female? So try to answer, male or female? Yes. Dr. Demon, try. Sajit Kumar. Rectangular orbit. Whenever word rectangular orbit, male skull. ठीक है, male. Good answer. Rakesh got the answer. Male. ठीक है. Fine. Yes, thank you, Demon. So we are very happy to hear from you that our classes, especially FMT classes, are helping you in prof exam. Okay. Good, do well, all the best. We are there to help you as a team of PW Med. चलो हो गया.